For the past 20 years, Simcoe County has been giving $3 million a year to its local hospitals. That number hasn't changed since 2006. Now, a consultant's report says it's time for an update.
What is really the capital needs in the healthcare sector these days? That's in order of billions of dollars. And this $3 million is a small portion of that funding that the county is providing.
The county hired Ernst Young a year ago to review the program. The consultant recommended changes. He said construction costs have more than doubled since the funding was set and the amount needs to be revised.
If you look at the construction sector alone, the construction or building CPI has increased by 110%.
He also found that hospitals in Ontario plan their projects alone. There is no requirement to work together and no one shares information.
Can the costs be reduced by collaborating and sharing information between the hospitals? Are there services that are duplicative? Are there services that are not needed for a local area and the hospital is following that?
And he said the province doesn't cover technology or equipment costs. Hospitals have to pay for those on their own. But one recommendation set up the biggest debate of the day. It would limit county funding to hospitals inside Simcoe's borders. That would cut off Southlake in York region, where thousands of county's southern residents go for heart care.
But I can tell you that it's very difficult for me to sit here and say to the southern portion of the county that we're not going to help support Southlake, even though they provide major services to many residents.
Other councillors disagreed. They said county tax dollars should stay in county hospitals.
I can't say enough how much I disagree with Councillor Leduc's comments. The County of Simcoe residents have utilized, and you mentioned it, Councillor Leduc, Sick Kids. We've utilized Sunnybrook. We've utilized St. Mike's. We're going to complicate this if we look at every hospital that we've used.
An amendment to keep funding Southlake went to a vote. It was defeated. The report also asks the province to consider amalgamating hospital planning. That word made several councillors uneasy. They worried residents would think it means closing hospitals.
Thank you, Chair. I appreciate the advancement in the discussion of eliminating the word amalgamation. We've got 4 great functioning hospitals, a little over 1,000 beds, spread over 1.86 acres of land, serving 533,000 people, give or take. The word amalgamation makes everybody anxious. I think I support the formalized arrangements that you had mentioned.
I just want to say, I think everybody's getting the fear of closing and amalgamating. What I see from my background with healthcare and different things is we're talking about services. We're talking about consolidating services, ensuring that every hospital does the best they can so that when I go or you go, you get the best care for your new hip, you get the best care for cancer treatments. And I think we're getting worried that we're going to close hospitals. And I don't think you can, because of the size, as Councillor Snell said.
In the end, Council passed the report as written. Hospitals will be asked to plan together. Staff will study raising the $3 million funding, and the warden will write to the Minister of Health asking the province to do better. Here is that discussion from the Simcoe County Council meeting.
We do have a very important report that we're going to hear from GM Sinclair. So I'd like to ask GM Sinclair to introduce the representatives that are here to talk to us regarding the Hospital Alliance.
Thank you very much, Mr. Chair. Good morning again, everyone. I'm very pleased to introduce our presenter this morning, Babak Agdoi, who's the partner from Ernst Young LLP. And just before I turn the podium over, I just give some context to this presentation. About a year ago, through council direction, we appointed Ernst Young, I always want to say Ernst Young, to complete a review of long-term capital planning for hospital partners. The county, of course, has been a long-time supporter of our local hospitals, and we've been hearing of late the increased pressures associated with increased capital costs for our hospital partners. So we brought in Ernst Young to look at twofold, really, to look at identifying any opportunities for increased efficiencies or increased effectiveness of funding and planning for long-term funding for our capital hospital needs, and also to identify any potential opportunities to advocate to the province for improvements to the provincial funding program. And so Mr. Agdoi is going to go over the review process that has occurred over this past year and discuss the recommendations. And there are 6 recommendations that they have brought forward for Council's consideration for the existing policy. And there are 5 additional recommendations from this review process for advocacy to the province. So with that, I'll turn the podium over. Thank you.
Welcome.
Thank you very much, Mr. Chair. Thank you, GM Sinclair. Good morning, everyone. It's great to be out of the hydration break. So, as GM Sinclair mentioned, we did this study over the past year or so. I'll walk you very briefly through what we did in the study, which was in 4 steps. We looked at the current state of the funding that's being provided by the Simcoe County to the Hospital Alliance. We did a jurisdictional scan on what are the leading practices for funding healthcare projects in Canada and abroad. We validated some of the findings with the stakeholder engagements. I'll walk you through the groups of stakeholders that we interviewed, and we came to a set of recommendations. As Jim Sinclair mentioned, there are 2 categories of recommendations. There are a set of 6 that is within the control of the county, which is related to the funding policy itself. And there are a set of other recommendations that is outside of the funding policy that goes to how the ministry and the province are managing funding of healthcare projects across Ontario. So I'll walk you through those separately, I think, in a minute. I won't spend too much time on this. There was a report, I believe you are up to date and aware of the state of the funding that's being provided by the county. I would draw your attention to a couple of things in this slide. One thing is that the level of funding provided is $3 million per year, and this funding has been in place since 2006. So this scale is important because I'll walk through in the next slides what is really the capital needs in the healthcare sector these days. That's in order of billions of dollars, and this $3 million is a small portion of that funding that the county is providing. But the point of the funding, I believe, is more around fostering collaboration among the hospitals and healthcare facilities that are operating within the boundaries of the county. You see the objective of the funding on top of that is around collaboration. So bringing the hospitals to a table so that they can share information and make joint decisions. That's key. You see this collaborative theme across different parts of this report, as I'll walk you through. So I'll just draw your attention to that. And the other thing is around the requirements for provision of the funding. This policy is aligned with the Ministry of Health requirement. There is a final estimate of cost, or FEC, that the ministry is requiring. Your policy is aligned into that policy in terms of requesting the FEC and providing the funding to the hospitals. We have further recommendations on improving this, but overall, there is an alignment between the provincial policy and what's happening in the county. Great. So as I mentioned, the first step after doing the current state assessment was speaking with the stakeholders that are involved in the project. And there were 4 sets of stakeholders that we contacted. Firstly, we contacted the administration, senior administration and councillors at the county level. We spoke with the alliance members, most of the CEOs or the representatives from the hospitals participating in the policy. And we spoke with the Ministry of Health, MOH, and Ontario Health, or OH. There were probably 5 themes that we discovered out of these stakeholder engagements. The first one was around the level of funding. As I just touched on that, the current policy is $3 million a year. So some hospitals recommended increasing this level of funding. And the reason for that is, firstly, the pressures and the escalations and inflations that happened in the past 20 years. And secondly, around the scale of the investment that's needed in the healthcare sector, as I just talked about. The second recommendation was amending the policy so that the eligibility requirement for participation in the program changes a bit. Currently, this policy allows for all of the healthcare facilities that provide 20% of inpatient and day surgery services to apply for the funding. What we heard in the interviews, mainly from the hospitals, was that this can be tweaked by increasing it more than 20%. And the logic for that from the perspective of the hospitals is, can local hospitals receive more funding so that they can scale up and they take over the services that are being provided by other facilities that could be outside of the county? So this was a request coming from some of the member hospitals. The third one was around the funding, and I elaborate on that a bit here. These projects, healthcare projects these days, are in order of hundreds of millions or billions of dollars. And there are some pressures on a couple of components of that. The construction portion has increased a lot. There are specifically two pieces of the funding that are challenging for the hospitals. Those are the fixture and equipment, furniture, fixture and equipment, and the IT costs. IT or ICAT has not been part of the funding historically, but as the new hospitals are very advanced in terms of connecting the equipment and pieces of information together, the cost of IT has increased. So hospitals are raising the pressure on funding IT costs that is currentry not done by the ministry, and also the FF&E costs that, as I mentioned, is outside of the ministry's policy. We took back these comments and spoke with the Ministry of Health about them. MOH is currently reviewing the IT costs. They are developing new guidelines for funding the projects, and IT is a big component of that. They are considering it as a major component and will include it in the next round of the guideline that's being published. We don't know the timeline, but they indicated that it's going to be enrolled in the near future. And around FF&E, the ministry's comment was that FF&E is something that's being covered through operating phases of the project. So still the hospitals do the capital investment, but they can recover it through post-opening operating funding that is in place. The other two themes that we heard was around collaboration. As I said, I'll get back to this point quite a lot. We heard from interviews with the administration that collaboration probably is not as intended at the level that this policy wanted it to be. So there is room for improving the collaboration and discussions among the hospitals. When we took this feedback and spoke with the hospitals are raising the fact that it is not a requirement of the policy for them to do this kind of collaborating activities. And MOH confirmed that the model in Ontario, as I'll get back to that in a minute, is an individually planned capital for healthcare facilities. So MOH has overall policy, but then it leaves it to the individual hospitals to come up with the plans on how they want to do it. There has been a table in local health networks or LEANs before. That table has been eliminated. That has been transferred to Ontario Health. But Ontario Health, as we heard, is not proactively working with the hospitals to come up with the plans. So from a high level, from a provincial perspective, this collaboration is not being proactively followed by the local hospitals, and local hospitals do not speak with themselves on how they want to plan. And this raises a big gap there on, can the costs be reduced by collaborating and sharing information between the hospitals. Are there services that are duplicative? Are there services that are not needed for a local area and the hospital is following that? So all of these questions is showing there is a gap. At the highest level of the provincial planning, things are being strategized. At the lowest level, local individual hospitals are doing it. But this middle layer of collaboration is missing. And that was validated in all of the discussions that we had. And the last one is around the site location and the needs assessment. This goes with the collaboration. Hospitals make a decision on site selection on their own. And there is no requirement from Ontario Health or Ministry or even the municipalities to input into that process. Most of the time, they make a decision and they just inform everyone else. And that level of sharing of information is completely broken. So again, this is a gap that we identified: site selection, needs assessment, all of the clinical needs that should be done are currently at a very base level and not at the consolidated level. With that, we did a little bit of a jurisdictional scan, and we looked at other places in Canada and abroad. In Canada, we looked at other provinces, Alberta and BC mostly. And abroad, we looked at some jurisdictions who do the planning more successfully. If you look at some of the countries in the Scandinavian area, Germany, Denmark, Sweden. And if you look at Australia and New Zealand, they are running the systems pretty efficiently. So doing this research, we went back to the themes of how the projects are funded, how the collaboration is happening. And in the next one, I'll talk about how the needs assessment are being done. So funding is pretty consistent across all of the jurisdictions. Ontario is probably a bit different. The province provides funding, but it requests a local share to be funded by the project, by the hospitals themselves. This local share has become a big component of the funding as the hospitals shared with us. They mentioned that it could go up to 30% of the costs. And if you imagine a $1 billion project, this is something like $300 million that local hospitals have to raise. So a significant portion. This is different compared to other jurisdictions. Other jurisdictions have the combination of funding, but they do not leave it to individual hospitals to do that. There are usually authorities or regions that add to the national level of funding. So again, Ontario is a bit different in that sense. When it goes to collaboration and regional planning, again, Ontario, as I just talked about in the previous one, is very different to the other jurisdictions. You look at Alberta, BC, Denmark, New Zealand, Australia, all of them have a combination of review between the national central level and the local regional level. The applications go there. Either they collaborate with each other or there are panels that are formed and those panels review the applications as a whole. The model is more or less everywhere a portfolio planning model, not an individual planning model. So again, Ontario is a bit different on that sense. And then the last one around needs assessment. Again, the theme of collaboration comes here again. Needs at those other jurisdictions are assessed at a high level. Like, as I said, at the portfolio level need, not the individual level need. And you see that everywhere. Alberta, BC, and all of the other jurisdictions abroad have this regional level that collaborate in terms of understanding what the local residents need and then planning for delivery of that. So I would just wrap this up. As I touched on it, Ontario is pretty different. It's pretty unique. Everywhere else that we looked at, the funding and the needs assessment and the planning has been done collaboratively. And there is a layer that pieces individual hospitals together. Ontario is different in the sense that Ministry of Health leaves it to the individual hospitals completely. And they just review the application as a standalone application, which in our mind is not the most efficient way of planning. I will give you these case studies as well, because this issue has been around for a long time. The model of funding capital projects in healthcare in Ontario has not changed in the past probably 30 years. But there are pockets of collaborating networks or forced collaboration in some areas that has been observed in the province. The University Health Network is the first example of that. They came together in late 80s and 1990s. That has been a very successful model for delivering care in Toronto area. The province mandated amalgamation in Niagara region. So that was done in late 1990s as well. There are other examples of that. More recently, in the Waterloo region, 2 of the hospitals decided to do it voluntarily. And it's not on this slide, but Halton Healthcare, for example, is another model of that in the Halton area, they own 3 or 4 hospitals and they do the planning at the regional level. All of this shows the benefits of having networks and collaboration among hospitals. It's either voluntary through the hospitals making the decision or forced by the province. I'm giving this example because as we go through the advocacy part of the recommendations, we think there is an opportunity here with the province of Ontario to have the discussion and maybe go through this kind of amalgamation at some point in Simcoe County. With that, I'll wrap it up. These are the set of recommendations. As I mentioned, there are 6 recommendations and 5 advocacy activities that we came up with. I'll walk you through that, but this is pretty high level. I'll pause and we can have the discussion around it. But the 6 recommendations are, firstly, this policy that you have in this place is around collaboration. So we recommend to reinforce it by amending the policy so that it's written there that the applications should come collaboratively. There should be discussions among hospitals when they do the planning, and then they come with the evidence of that discussion to you for the request of funding. The other one is around the, as I mentioned, currently the policy provides funding to every hospital that has a minimum of 20% service in the region. We are recommending to revise that and review that. You may want to increase it to a higher level. You may want to increase it to 100%. So only the hospitals that are within the geography, or a higher portion of services that are being provided. And that provides opportunity for the smaller ones to receive the funding and scale up. We think the economic benefits of that is justifying some of these recommendations. The third one is around, again, revising the policy. One of the issues that we heard from the Ministry of Health was that one of the reasons that the costs of healthcare facilities are increasing so much is that hospitals in their application have a lot of non-clinical spaces baked into the application for construction. So as I mentioned, hospitals see that 30% of their cost should be locally sourced, but the ministry doesn't see it that way. The ministry says most of these costs are ineligible from our perspective, because you're building ineligible spaces for offices and the doctor rooms and stuff like that. If you exclude that, if you build it somewhere else, you can make it more efficiently at less cost. So we are recommending that you align with the Ministry of Health's recommendation on that. So when you receive the application, you look at eligible versus non-eligible areas, not just the overall request that comes from the hospitals. The fourth one is around community health. So again, empowering local healthcare providers to provide services. And by doing that, you would need to define KPIs and then bake KPIs and information from that into the application and the funding request. The fifth one is around collaboration with Ontario Health. As I mentioned, Ontario Health is not proactively involved in the planning and the work of clinical service design. The county can share more information with them. You have, what we understand is that you have more detailed information at your disposal that Ontario Health doesn't have access to that. So we're recommending that you provide proactively this information to Ontario Health so that they can make better use of that information. And the last one is the increase in funding, as I just talked about. There is a potential there to increase it. I'll give you 2 data points. In the past 20 years, if you look at the general consumer price index, the CPI has increased by 52% since 2006. If you look at the construction sector alone, the construction or building CPI has increased by 110%. So having these 2 data points is showing that the 3 million probably needs to be revised, as it was said 2 decades ago. And then the last one is around the advocacy part. So all of those 6 recommendations that I talked about were around modification and amendment to the policy, everything that you can do to go back to the objective of more collaboration. These are a set of 5 that we believe you can follow up with the Ministry of Health and Province for, again, making that gap that I talked about in planning less of an issue. The first one is around considering amalgamation. So actually, province proactively coming and looking whether there is a case here. So basically forcing the amalgamation similar to what happened in the Niagara region. That's one recommendation. The second one is for the ministry to accelerate whatever they are doing in funding IT costs for the project. They mentioned that it will be released, but we don't know the timeline. So you can proactively follow up with the ministry on that. The third one is a shift towards more regional collaboration. As I mentioned, the current policy is the ministry has a strategy, individual hospitals respond to that. And the capital planning guideline does not have any provision of this middle layer of information sharing and collaboration. So we recommend you to request the ministry to bake these things into the policy that they have. The fourth one is around requesting information around it. So in a similar way that we recommend you request hospitals to share information with you, the ministry should do the same in asking the hospitals to work with each other more proactively. And the last one is around use of analytical tools. Again, I know it's an initiative that this county has, and we advocate it in all other infrastructure builds, particularly healthcare. Is currently technology is there to plan and to simulate and to understand where the pockets of demand are in future. But that is not being used in the healthcare sector proactively. So can the ministry have this policy of doing simulation and requesting the information and scenario planning future of healthcare instead of the current model that is being done? What we heard from the hospitals is that from the time that they make a decision on making an investment to the time that it's approved, it takes up to 8 years. So the question is, can we really understand today what is needed 8 years down the road and add to that the construction period and so on and so forth? So it can easily get over a decade from the time of planning to the time of opening a facility. And without the tools and the analysis, this decade is basically renders a facility not effective 10 years down the road. So we advocate for using more informed decision-making and shortening of the process from the ministry side. With that, I'll pause. I'll pass back to GM Sinclair and any questions.
Thank you very much. Happy to respond to any questions at this point.
Thank you very much for the presentation. Very interesting opportunities that have been presented. If there are questions from the floor, can you please acknowledge? Okay, Mr. Leduc, and then go ahead.
Thank you, Mr. Chair, and through you to Babak. I just need to find out where the recommendation came to not fund hospitals within the geographical area. And I'm specifically speaking to Southlake. They're not in our geographical area, but they actually provide a very important service to a lot of the residents of Simcoe County. They deliver cardiac care at a level 7, and RVH delivers it at level 4. So there's quite a difference in the cardiac care, and a lot of our residents from Simcoe County end up at Southlake for that cardiac program because RVH can do stints. Southlake is going to eventually move to a level 8, which they're moving to now, and that'll be everything but a heart transplant. So to me, that's a service that many residents in our community many residents in Simcoe County is going to use. When I look, we have two really major hospitals as far as I'm concerned, Southlake and RVH. The others are important hospitals, Stevenson Memorial, we all use them. Our residents need all these locations. But I can tell you that it's very difficult for me to sit here and say to the southern portion of the county that we're not going to help support Southlake, even though they provide major services to many residents. I mean, my daughter had twins. They had identical twins. She was in Mount Sinai for 37 weeks. We use hospitals all around Ontario. Specific hospitals, different hospitals provide different services. We use Sick Kids. Sick Kids is the main hospital for kids programs throughout Ontario. For us to sit here and put a message out there that we're going to do a marketing share plan in a sense that we're going to only market within our own border doesn't make sense to me. Healthcare is a provincial issue. I fully support some of the recommendations in there, but I have real trouble with recommendation number 2, and I'd have to amend the recommendations on the floor to exclude recommendation 2 because I really believe it's a message that I don't want to send to people in Simcoe County. Southlake does provide cancer care and cardiac care, specializing in both. RVH specializes in cancer care also. So for us to sit here and say that we can't support hospitals outside of our geographical area when I have lots of stats here that prove that many residents in Simcoe County use Southlake, and I can bring those stats to the table after, but I really need to understand that we need to move recommendation 2 out because the alliance, when it was formed, and I think you picked up on it, collaboration, working together. And I can tell you, not every hospital can provide the same services. That's not what we want to do. We want to specialize in areas. And I think this alliance of 7 hospitals in our communities in our Simcoe region can help that by working together to ensure that certain hospitals can pick up other services that we require. So a patient can go from one area of the southern portion of the county, maybe up to Collingwood General for a specialized service there, not duplicated with the other hospitals. So I know it's outside the geographical area, but it actually has a large portion of residents that use, Simcoe County residents that use that hospital. It's an important aspect. So to me, definitely number 2 recommendation has to come out. I can't sit here and support that because it's important that we show that we want to collaborate. We want to have that collective work together. I absolutely agree with the information technology that has to be included into the planning process. There's a lot of things in this report that are excellent that we need to advocate for. The province has allocated, there's 52 billion or 59 billion to new hospitals, and we're all fighting for that funding throughout Ontario. That doesn't go a long way. Just recently, we went through an exercise in Bradford, West Gwillimbury, about acquiring Southlake building their second location. That was a $2.5 billion exercise. That's improvements to Davis Drive and then a second location. We knew from looking at that, we were going to be on the hook for around 650 million because that's our share. That'd be our regional share. So York Region would have to contribute to that. We would have, if it landed in our community, we knew we had to come up with $250 million out of our community. So it's tough. It's difficult. There's a lot of funding that has to come from the area, but I really truly believe that we cannot disregard Southlake as part of our core servicing for hospitals for Simcoe County. This is a very important hospital, and I just can't support the recommendations as it is right now. So I will put an amendment on the floor to remove recommendation 2 when we get to that point. But just need to speak to that because that was very concerning when I seen that. I read the report and it talks about members suggesting that we remove hospitals outside the geographical area. I have spoke with Dr. Woods, the CEO of Southlake, and he mentioned to me that he had no idea about that. So I don't know if that came just from the chair of the alliance. Was that an alliance recommendation back to, was that a complete unanimous recommendation? Because I think that when I talked to Dr. Woods about this, he was flabbergasted. That was part of what we were talking about. The $3 million that we put in as a group is to support some of the opportunities for hospitals to bring certain services outside of what the province supports. I can tell you some of the funds that we've provided over the last few years. an MRI unit was built at Southlake with some county dollars, not a lot of them, but a little bit of money went into that MRI unit. They built 12 units for mental health care that had some county funding into that. So the Alliance, in my mind, works. I think it's a great thing, and I think we need to be a lot more collaborative, and I think they have to definitely plan a lot better. There's a lot of areas of this report that we can certainly pick on, but I have to ask this House to please support removing recommendation 2, because I think it sends a wrong message to the southern portion of our county. Thank you, Mr. Chair.
Thank you, Mr. Leduc. Mr. Leduc, if you would, I will go to at least 5 more speakers who have already indicated they want to speak, and then I can come back to your amendment if that's okay with you. Thank you very much. We're going to go to Councillor Evans, then Anderson, then Follis, then Verkuyk, and then Rawson. Please go right ahead, Mr. Evans.
Thank you, Chair, and through you to Babak and to Jane. Thanks very much for the presentation. Really interesting. Yeah, I think that you made a point just to Councillor Leduc's points, and you made a comment in there about essential and non-essential services. And I'm certainly not in favor, in my mind, a hospital essential services making people feel better. And I don't think any of us would sit here today and say that we would want to impact that negatively in any possible way. I am very interested, though, in your non-essential, or not non-essential, but under the classifications under the current provincial government and what's essential and non-essential. 2 questions. First of all, I know this consolidation has taken place. Chair just mentioned Grey County. I know where I'm from in Mississauga. It went through Trillium, and some of the roadmaps that are history that has been done in this already. We're not the first one to do that. Just first of all, if you have any comments in terms of our framework or our plan and how it relates or compares to other successful operations in Ontario. And then the second question, if I could, if you want to answer both at the same time, is great, is what is the appetite for change within the Alliance in Simcoe County? Are they open to this? Is this something that I'd like to say that, you know, in general comments, I know $3 million seems like a lot of money, and in your discussions, obviously, it's not a huge amount of money. What is our chances of success of being an initiator, a catalyst for these changes, and the opportunities for us to make what I think is very substantial but needed change to capture those synergies? How successful do you think we'll be?
Thank you.
Go ahead, sir.
Thank you. Through the chair. 2 questions, Chair Evans. The first one around how successful your policies compared to others. I'm very familiar with the model that Halton Healthcare is running in the Halton area. They have 3 hospitals, the Oakville, Trafalgar Memorial, Milton, and Georgetown. Your policy is very similar to that in terms of requiring hospitals to work together. What is the difference? And this is part of the recommendation we have here, is that you don't go as far as formalizing it and mandating it so that they work together. In your framework, it's more like a voluntary model. The objective and the intent is same, but the voluntary basis of that leaves the discretion to the local hospitals to do that. And local hospitals, with everything that they do, they are there to serve their own corporation. Hospitals in Ontario are standalone corporations. So for a hospital, the first thing that comes is the corporation, and the secondary that comes is collaboration. Unless you have this mandated objective for them to work together, I think they struggle to get that past that barrier. What Halton Healthcare does is that between Oakville, Milton, and Georgetown, they have a central planning function. There is a function at the corporate level that looks at what is needed in the Halton area, and then they pass it to locals to do that. They prevent duplication of service, they make it more efficient, and so on, and they share experience. So to your question, the policy is right. I think it lacks the levers and the mandate to achieve its objectives as it is in the county. Sorry, I forgot your second question.
The question was just more related on that same concept on a local level, and then through your discussions with the hospitals and the stakeholders, what is their appetite for change, or do they see opportunities, or is this something that we're heading into a headwind with?
Yeah, what we heard from the discussions with the hospitals is that they are, first of all, I said that it's a small funding, but they are really appreciative of the funding. So the hospitals recognize the contribution that the county is making in that regard. So they are appreciative of that, and they feel that they are doing their best to collaborate. When we talked with them about these recommendations were validated and vetted with the hospitals before we finalized the report. So we presented to them in one session, we collected their feedback, we went back, revised it, and we presented in a second session. I didn't see any pushback on these recommendations, even number 2, which I think is a little bit of a hot topic here, but they are fully supportive of that. They feel also that collaboration helps them in doing things better, more efficiently. And I don't think there is any resistance on that.
Great. Thank you very much, Babak. And I know there's lots of questions, so I'll pass it back to Chair. Thank you. Thanks very much.
Very interesting discussion there at that point. Councillor Anderson, and then Follis, then Verkuyt. Please go ahead, Anderson.
Thank you. And through the chair, generally, just as a comment, I'm a firm believer that the county needs to stay in its own lane, and looking at healthcare advocacy to the province is something that I think we don't need to be involved in. I think the hospitals directly need to be involved in that. This program was set up to support healthcare, not to fund it, not to overstep our bounds with the provincial government funding. This is to help our local health hospitals fund their community share in these programs. And I think that's what this policy needs to reflect. So with the recommendations of going above and beyond that, I do not support. And I believe we need to get back to the basics, that the Hospital Alliance is there to support a goal for our local hospitals, and then the county council to decide where that funding goes to. And I think it's simply that policy. So I can't support this recommendation at all. Thank you.
Thank you very much. We'll go to Councillor Follis, who can ask a question here. Please go right ahead.
Thanks very much. So I had two statements, two thoughts. One was I did want to really express my support for Mayor Leduc's proposal. Happy to second it. I think that is certainly an important consideration that we have residents that access services outside of our own county boundaries, and we need to really keep that in mind. The second piece, and I wasn't sure if an amendment would be required, but just around recommendations of amalgamation, I had come across a report, it was written in 2021. It's called The Impact of Hospital Closures and Mergers on Patient Welfare. It's written by Barker, Watt, and Trammer out of Queen's University. And they had quite an interesting kind of summation of their findings that I think it would be just worth reading through them very quickly if it's possible. In recent decades, public health systems operated by governments have experienced directed hospital mergers and closures, despite a lack of consensus regarding the impacts on patients. Cost savings and efficiency gains are frequently proposed arguments in favor of amalgamation of hospitals funded or administered by governments. These arguments have also been used to consolidate other things. But such arguments ignore any potential impacts on consumers. This is especially true in settings where prices paid by consumers for services are fixed or zero. Patient welfare can be negatively impacted if hospital mergers remove acute care services from some locations, as some patients must travel farther to access care. Increased market concentration can also negatively affect patients if it limits competition between hospitals. In systems with administered prices, i.e. hospital markets where prices are set by regulators, this may take the form of reduced quality competition. And it goes on and on. It does say that there is potential for positive impacts, but there's certainly potential for negative impacts as well with mergers. And they just in reading that and reading the recommendations, I'm wondering if the language can be explore this as a potential rather than having it as a prescriptive recommendation, because I think there's a lot of potential ups and downs that need to be considered before we just push ahead with saying we should be merging the hospitals into one network. And I guess I'll look to the chair to suggest whether an amendment would be appropriate.
All right. Thank you very much, Councillor Follis. The first item I'd like to just acknowledge for you is that while we're permitting you to ask questions, you're not a voter on this item, so I can't ask you to be a seconder. Sorry. But I acknowledge what you're looking for there, and so we'll deal with that through our procedures. And so I'm not sure how I can answer your question any further now. Perhaps I could move to other speakers, and I'll consult with the clerk if there's a concern there. Mr. Verkuyk would like to go next, and then Mr. Rawson.
Thank you, Chair. I've been a lifelong resident of Bradford, West Goldenberry, and Simcoe County, and a proud member of Simcoe County. But I've also, Southlake has been our hospital all my life. I was born there. My kids were born there. I had life-saving surgery there. We use that for our emergency services. Unfortunately, they didn't select Bradford, West Goldenberry for the next hospital, but the one in Queensville will still be the closest hospital. It will still be our hospital. It's going to serve right now. Southlake services probably about 80% of our population, which is about 40,000 people. And I know that it also services the south end of New Tech. And I just can't see how we can not support Southlake with that amount of it's part of our hospital network. So yeah, I can't support recommendation number 2. And I will second that amendment.
Thank you. I'll have one more speaker, and then we're going to come back to Councillor Evans, although I acknowledge Councillor Cox, you're on the list. So the next speaker will be Councillor Rawson.
Thank you, Mr. Chair. Healthcare is a complex topic, a difficult thing to accomplish. Jane, thank you for the report. I think it's well done. To you and the presenter, I think a lot of great work was done on this. We're all faced with impossible challenges, and I know locally, hospitals are telling us they're having a hard time to meet their capital demands. They're asking us on the local front, they're asking us at the upper tier front for more. We're being told today the $3 million is not close to what is being asked from our hospital alliance. I know locally, we've said no at our local challenge, a local council, no to $25,000. It has no impact on the big picture. We have to support this through the upper tier, and I think this reports have been so well done. I also appreciate Councillor Anderson's comments about staying in our lane. I think that's an important thing that we need to think about. This isn't about one hospital is better than another. It's about how we're going to have bigger impact. I can't say enough how much I disagree with Councillor Leduc's comments. This has nothing to do about Southlake or what they do or don't do. This is about who we can help. Every time we say yes to somebody, we have to say no to someone else. The County of Simcoe residents have utilized, and you mentioned it, Councillor Luke, sick kids. We've utilized Sunnybrook. We've utilized St. Mike's. We're going to complicate this if we look at every hospital that we've used. Jane could probably give us reports about how many times the County of Simcoe paramedic service has brought a patient to another hospital. We bring people to Owen Sound all the time. I think we're complicating by looking about this. This isn't about which hospital is better or not. So I think we got to look at what's our impact. Our local hospitals are saying they need help. I think we got to look at some more facts. So here's another fact. Our agreement with the Ministry of Health is that we fund 50% of ambulance service and 50% by the ministry. Our last report is, I believe, we're only getting 47% of the funding. So we're paying 3% more than we should. So I think we've got to look at what we should pay and how do we make up that difference. Maybe we can say the province that 3% you haven't paid us, here's your IOU. We can consider giving that to Southlake. I think, again, this is all a complicated topic, and how do we really help? A couple questions. I appreciate the comment about the amalgamation. I think Councillor Anderson mentioned this. It's a complicated topic, and we only spoke an hour today about strong chair powers and how we're going to look at. We're trying to figure out our own governance structure. Now we're trying to ask other hospitals to do this amalgamation. I think to Councillor Anderson's point, we should stay in our lane. My question is on the recommendation about amalgamation. Is this a request? Is this a thing to the hospital lines? Is this a request to the ministry? I agree on we should work together and do higher level thinking and planning. I think that's a good, strong point that was raised, but I'd like to understand more about that. And my other comment is about community. So we talked about necessary and unnecessary funding inside hospital. We also fund hospice. And we know that hospice delivers better care for people at end of life, cheaper than hospital. So did this look at community services? We've seen MRI in community, we're seeing X-ray in community. Did this look at other services that can be done in community and have bigger impact and less cost implications? Well, and Jane, thank you again. I know this was a difficult task, and I think from my lens and our lower tier lens, this is great. And we've been saying our local tier, let's don't do anything. Let's land on the county's land on this. Thank you.
Through you, Mr. Chair, if I can address a couple of the questions that have come up. So I'll start with the recommendation for advocacy on amalgamation. Just to clarify, we're not recommending the hospitals be amalgamated. The recommendation is there are similar models across the province for the province to simply look at the hospitals within the county of Simcoe. Is there merit? Would it make sense to bring them together in a formal way? So it's a subtle distinction, but I think it's an important distinction that we are just recommending based on the study, that they take a look at the situation. In discussions, and my counterpart, General Manager Wilcox, the two of us were kind of the staff leads for this whole process. And when we heard some of the information, sorry, I lost my train of thought on this one. Totally lost my train of thought on this one. However, the big takeaway for us was that planning, the collaboration and the planning. So the amalgamation is just consideration, looking at the current status. The one thing that we heard was that there's a lot of hospitals in the county of Simcoe, that it is kind of a one-off in terms of the number of hospitals. And that came from engagement studies with Ontario Health and with the Ministry of Health. So it seemed logical, that recommendation to look for the province to consider. Is there any benefits to formalizing a partnership with the local hospitals? So it is a distinction. We're not recommending, we're just recommending they look at that. Yes, 100%.
Through the chair. Councillor, I think the other thing I would add to that is, as General Manager Sinclair said, we are not saying something has to be amalgamated. I heard closure of hospitals. This is not the nature of the recommendation. As I mentioned, the examples that we have, in none of those examples, any hospitals were closed. The hospitals get together and they form more or less the planning function and the capital function combined. It doesn't mean that any services is being eliminated. It doesn't mean that any hospitals is not going to serve the residents. It's a central function that thinks about what needs to be done and where it can be done at the most efficient level. I'll just say amalgamation is around amalgamation of thinking and the planning, not closure and amalgamation of the actual facilities. Thank you.
Thank you.
Great, thank you. Councillor Rawson, thank you. Jane, did you have something else?
I was just going to also comment, the first recommendation for the policy that looks at that regional planning, from the feedback through the study, it was twofold. What E&Y recommended is that the hospitals, not the county, the hospitals do a longer term plan in terms of what are the clinical services required for the population in the county of Simcoe. We recognize this is not our service area and it's not our area of expertise. We're just requesting that the hospitals, who are the experts, do that planning together in terms of what are the clinical needs based on the population of the county of Simcoe. And then the second part of that is do an inventory. What are the services actually being provided at all the local hospitals now? And those two components as part of their long-term planning should help inform the capital needs in the long term, 20, 30, 40 years out. So just to kind of clarify clarify that component. And the third piece that I'll just comment quickly on regarding hospitals within the geography, the information we received was that was a recommendation that came through engagement with the various hospitals. But certainly we've discussed with E&Y an alternative would be to look at the criteria. That criteria of 20%, a minimum 20% of inpatient surgical patients has been in place. It's actually closer to 30 years. So that we also had discussions with the consultants about that being an alternative option as well, to revisit that criteria. Does it still make sense? Or are there recommendations back to County Council on that point? So just a couple of pieces I wanted to clarify.
All right, thank you very much. I'm going to halt the discussion at this point just to get this motion on the floor so that then I can entertain respectfully the motion from Councillor Leduc as an amendment. I'd like to just record McDonald, you'll be next here as well. So the councillors remaining to speak are Councillor Cox, Councillor Smith, Councillor Hamlin, Councillor McDonald, if you're all comfortable with that. So at this time, can I ask perhaps Councillor Rawson, would you like to move this motion? Perhaps the Deputy Warden, would you second the motion? I'll read the motion out loud. Is that comfortable? And then we'll go, pardon me? Yes, ma'am.
Does that mean that we're still going, you did say we would still go back to discussion, but once this is on the floor and it's read, we've run into this before, that means it's on the floor and there's no other comments that are going to make a difference because it's already on the floor.
Well, I would interpret that I would read this, put this on the floor, and then go back to our very first speaker, which was Councillor Leduc, who asked for an amendment before I'd even had it on the floor. So that's what I think I'd like to do. And I gave Councillor Leduc the benefit of the doubt that I had 5 persons already asking to speak, so I let them all speak up until that point. So if that's comfortable for everybody, I'd like to move that to this point where I put it on the floor. Any objections? All right. I'll read the motion and then we'll entertain some amendments. CCW 2026-188, June 23rd, 2026, regarding the Simcoe County Hospital Alliance Long-Term Care Planning Review be received. Staff revised the Simcoe County Hospital Alliance funding policy to reflect the associated recommendations 1 through 5 contained within item CCW 2026-188, and that staff consider an increase in the level of annual funding offered to Simcoe County Hospital Alliance members, subject to adoption of the recommendations 1 through 5 above, and provide recommendations to County Council in a subsequent report. And that the warden write a letter to the Ontario Minister of Health advocating for improvements to the capital funding program as outlined within CCW 2026-188. Thank you. I will ask Councillor Leduc now to just formalize his amendment request, and the clerk is prepared to help us with that as well. Mr. Leduc.
Thank you, Mr. Chair. So my amendment would be the first paragraph is fine. The second, that staff revise the Simcoe County Hospital Alliance funding policy to reflect the associated recommendations 1, 3, 4, 5 contained within item CCW 2026-188. Or it can say 1 through 5, save it except 2. Whatever the clerk feels is best to put on the floor, I would leave it to his suggestion.
All right. If you can record that, right? Look for a seconder, Mr. Verkijk. Thank you. And to the clerk, would you be able to review that for us?
Yeah, through you, Mr. Chair, absolutely.
Excuse me, Chair Measures.
Yes.
For clarification, on the motion, it's asking us to approve 1 to 5, which includes the increase in funding, but there's 6 recommendations. I just want to make sure that we're voting on the right thing. Am I missing something?
Please.
To clarify the recommendations, 1 through 5 are policy adjustments. The 6th recommendation is for staff to look at potential increases to the funding allotment, conditional to the policy changes 1 through 5, and come back to County Council at a future time with recommendations for the actual amount, annual amount in the policy.
Thank you.
Thank you. That's good clarification. That's better. I think the final thing too would be that the letter of the warden would write for advocacy to the minister. Councillor Cox?
Yep, through the chair. I also think that last paragraph about the warden writing a letter, would you not want to include the recommended points for the county's advocacy to the ministry? Because there are 5 recommendations there.
Through you, Mr. Chair, the letter would outline the 5 recommendations, the actual details.
Should we not make sure it's included so it's clear? Or no? It's up to you.
We can update the actual recommendation. It just refers to the recommendations outlined within the report rather than spelling them out in the actual recommendation. But just to clarify for County Council, the intent would be the actual letter from the warden would include each of those 5 recommendations.
Okay, I just wanted to make sure that it wasn't just capital funding because there's other advocacy
That's
recommendations.
correct. It's all 5 of the
Thank you very
recommendations.
much.
Okay, I'm going to hand this back over to the clerk. Thank you.
Thank you, Mr. Chair. So I'll try and, if I may, just help council with this. I hear 2 debates sort of happening at the moment. And I'll just get this up on screen. So we do have a main motion. It's been moved by Councillor Rawson, seconded by the Deputy Warden. It's the recommendation as printed in the agenda. There's the first clause to receive, the second clause to revise the funding policy to reflect the associated recommendations 1 to 5. The amendment coming forward is essentially to remove number 2 in here. And so the amendment coming forward will impact these 2 clauses here, 2 and 3. And then I'm hearing a second debate, and perhaps, Mr. Chair, we'll get through this amendment that we're dealing with currently. And if there's further discussion on the sort of amalgamation piece in the advocacy to the Minister of Health, that can be a separate amendment. But what we're dealing with right now is clause 2 and 3. So the amendment, and I'll look to the chair to confirm with the mover and seconder that this is appropriate, but that clause 2 and 3 of the resolution be amended to remove recommendation 2 regarding the Hospital Alliance policy. And so that's funding within the geographic boundaries of the county. So the clause 2 and 3 would read as follows: that staff revise the Simcoe County Hospital Alliance funding policy to reflect the associated recommendations 1, 3, 4, and 5 contained in the report, and that staff consider an increase in the level of annual funding offered to SCHA members consistent with the recommendations supported above, so without number 2, and provide recommendations to County Council in a subsequent report. So I hope that's helpful, Mr. Chair, and maybe just look to the mover and seconder to confirm that captures their intent.
And that, ladies and gentlemen, is why we have an amazing clerk. Thank you. It is very clear to me. I just want to confirm with the Mr. Leduc, Mr. Verkijk, are you comfortable with that?
Yep.
All right, they've acknowledged yes. Are there any comments about the proposed amendment? Mr. Smith?
Thank you, Mr. Chair. Just before we go to the vote on this amendment, I'd just like to beg your indulgence on a couple of things. Number one, I can't support this simply because, you know, we are the County of Simcoe. And the Hospital Alliance are hospitals within the County of Simcoe. And I've heard some of my friends here in the House talk about staying in our own lane. And I couldn't agree more. You know, I can tell you that I was a patient at Southlake, and it is an absolutely amazing hospital at every level, from candy stripers right up to surgeons. You know, I've often said that many CEOs could attend a few months with the CEO of Southlake and really learn something about how hospitals should be run, because I can't say enough good about that hospital. And the morale amongst staff and so on and so forth. But it's not in Simcoe County. And yes, we have a lot of folks in Simcoe County who attend Southlake. As I said, I was one of them. But we also have a lot of folks who attend sick kids. And the next thing you know, we'll be saying, well, you know, because of that, we should be giving money to sick kids or, St. Mike's or whatever the case may be. Southlake is in York Region. So one question I have, if I may, Mr. Chair, is what other regions are we aware of, or is this the norm, where the regions or counties are supporting these hospital alliances with county tax dollars or regional tax dollars?
Question, please. Go right ahead.
Sorry, Mr. Chair, we do not have a list. We understand it's a mix. There are many municipalities that do not provide funding at all, and there are other municipalities that provide various levels of funding. York Region used to provide funding to their hospitals. Our understanding is they no longer provide funding to their hospitals. They've stopped that funding. So it's discretionary, not mandatory. So it's totally up to each individual county, region, district across the province in terms of providing this additional funding support.
Thank you very much, Jane, and thank you, Mr. Chair. So if I may, Wasaga Beach sees 2 million visitors every summer. Blue Mountain sees millions of visitors every year. And those visitors come from all over the province, all over the country, across North America. And believe me, they visit our hospitals. Collingwood General Marine Hospital is inundated with visitors. I don't see any other regions, municipalities, or provinces sending money to Collingwood General Marine Hospital. I know I'm going a little over the top here, but I'm trying to get the point across that, we really do need to look after the hospitals in Simcoe County. York Region's a great region, and if Southlake needs that help, York Region, if that's the case, and that council should decide to do so, then that's where they will get their funding from. But at the end of the day, I think what's most important is that, the fact that this council has been very clear over several councils to recognize the importance of the funding that is required. I mean, our hospitals are doing the absolute best they can with what it is that they're given to work with. And does that mean, what isn't there that we should be picking that up? No, it's not our responsibility. We do because we understand the importance of it. The other thing I'd just like to touch on is amalgamation, because although it's a great report, and thank you for all the hard work and dedication that went into it, I'm confused because if we're going to say amalgamate, we really do need to identify and define what it is we're looking to amalgamate. Because most people hear amalgamation and say, you're going to take 2 hospitals and make 1. And, we've heard today that the county of Simcoe is a one-off. It's very unique with the amount of hospitals we have here in Simcoe County. So if we're thinking that amalgamation is required, whether it be for hospitals or services or staff or whatever that it is we're thinking of, and I'm sorry, but I'm just not clear on that at this point, then does that mean instead of building a new hospital that is 3 times larger as we go down the road here, that we should be building hospitals that are 7 times larger because we could be seeing less hospitals in our region? And what does that mean to emergent service in our region? So although a great report and lots of good information, it raises a lot more questions in my mind. And until those questions are answered clearly for me, I really struggle with dealing with this in its entirety, period. But I'll get back to my main point, and is that I cannot support this amendment because, based on what I'm hearing, we'll be asked to support every hospital across the province at some point or another because, let's face it, patients and people travel and services are better in different areas. And those services need to be looked after, A, by the province, it's their responsibility, but B, by the respective regions in which those hospitals stay. Thank you.
All right. Thank you very much, Councillor Smith. I just want to remind all the members we're talking about this amendment in front of us, not the discussion about amalgamation yet, but I appreciate your comments. I do have Councillor Hamlin, I believe, online who wants a question about the amendment, please. Councillor Hamlin, I think your microphone is muted.
Sorry. I think the Councillor Smith has just summarized what I was going to say. And I'll just add that, I just really, I accept the premise that we stay in our own lane that was expressed earlier. It's not really a job for the County of Simcoe to be funding hospitals. We all want to, and we do. And I think, that's a strength of the county. But we're a small population over a huge area. And I really think this is, an area where we just have to stick to our knitting. Like, how do we decide? We've all used all these hospitals around the province. And I sure appreciate what I've heard about members and their families using the hospital in York Region. My own husband spent a week there. I totally get it, but I think we have to pick. And unless others are contributing to our area hospitals, how do we pick? We can only pick based on where they're located and what our jurisdiction is and where our taxpayers are paying money. So I just want to say I don't support the amendment. Thank you.
Thank you very much, Councillor Hamlin. I'm going to go to Councillor Verkuyk. I'll go to Mr. Leduc following. That'll be the final speaker. So, Mr. Verkuyk.
I don't think the argument for this amendment is saying that we have to support St. Mike's or sick kids or hospitals where people might show up. This amendment is to reflect the fact that we're going to support our tax dollars for local hospitals. We have to include all the local hospitals. And so Southlake is the local hospital for a significant portion of the population. That's the argument. And if we're, the other argument I can buy, should we be supporting hospitals at all? But that's not part of this amendment. We can have that discussion afterwards.
All right. I just want to halt you for a second. Ms. McDonald, did you have something on the amendment you want to speak to? You're on my list, so I just wanted to make sure. Do you mind? I'll let her go first, please. Go ahead.
Thank you, Chair. Thank you very much to Councillor Smith and Councillor Anderson for their input. It was a lot of what I'm thinking, and I just worry that I haven't heard, or we haven't heard really much about from the alliance, and that's what troubles me, is because if we start sending messages to the province with certain wording that we already know in past tense, how they take over and they make it something else completely. That's my worry, that we start off with something, and then we send a letter off to say, this is what we're thinking of. And then they change it and they look at a bigger picture, and all of a sudden they come back to something that we can't change. That's my biggest worry for what we're looking at now, is going in. Some call it stay in our own lane. I think sometimes that the province loves it, that we have the heart that wants to help everyone in their hospitals, because that means they don't do their job and their funding. And I find that is a big problem in itself. So those are just my comments. Thank you.
Right. Thank you very much. Councillor Leduc, would you like to wrap this up on the amendment discussion? And then I'll call the motion.
Yes, thank you, Mr. Chair. And I want to reiterate what Councillor Verkuyk said. This is about the alliance funding, and that's what it's about. Southlake has been an alliance member for 20 years. It is a hospital within Simcoe County. So I fully support the recommendation as written, and I hope I get support of the House for this recommendation. Thank you very much for the amendment.
All right. Thank you very much. House, the recommendation for the amendment is on the screen. Is it required for me to read it? It's all available for everyone. Mr. Clerk, you're comfortable? Yep. Okay. Then at this point, then we have a mover and seconder, and I am prepared to call the vote on the amendment. Those in favor, please. Those opposed? I would suggest that will not carry, so that is defeated. We're now back at the original motion, and with the discussion that's been put forward, is there an item in regards to a future amendment? Mr. Gordon.
Thank you. No amendment. I'm content with this the way it is. I'm also, unless I misheard, the Hospital Alliance was participants in this report. They're not, we're not, subjecting our will upon them. They worked through multiple drafts. They are okay with all the recommendations, including the potential for amalgamation, knowing that it could come with or without their consent anyway. and that I don't really want to mess with this. This is hard work done by the consultants in cooperation with our alliance, presented to us as effectively a joint submission, if you will, if you want to use a court term, ready to go to the province. They're going to do what they want anyway, but here's an informed, consensual, mutually agreed upon path forward that even the hospital boards, who typically resist, and bristle at the thought of, one CEO and one, leveling the playing field and having one overarching umbrella without closing hospitals down, but just having the governance level pared back, much as we're seeing here at our own council. I think this report should go as it is, unadulterated. All the work's being done, the consultation's being done. It's basically for our information, and we're going to forward it to the province. They're going to do what they want with it anyway. So I won't be supporting any further amendments. I don't think there's any need to micromanage this any longer. We spent the money. We got Ernst Young involved in this. This is not Joe Bob's consultant that did this for us, and all the Hospital Alliance partners have bought into it, and I'm quite content to support this as it stands. Thank you.
All right, thank you very much. I want to review back to the original list. I think all of the speakers have already spoken. Cox, Smith, and Hamlin. Did you have anything else you want to add to the regular? Mr. Smith, anything further on the motion? Councillor Hamlin, yes, your hand's up. Go right ahead.
I will have a comment on the amalgamation. Chair, is this a good time?
Excellent. Go ahead.
Yeah. Okay. Thank you. I just have a question for our consultant about the county of Grey. And I ask this because, of course, our municipality is on the west side of the county of Simcoe, and we see lots of interaction between our residents and the residents on to the west of us. And of course, there's a hospital in Markdale and one in Grey Highlands. In other words, in Markdale, Grey Highlands, and also in Meaford, which are about the same distance as RVH. So I don't want to get into the merits of whether talks should be held with them, except my question is, aside from the fact our county paid for this report, was there any thought of including the other hospitals in the region with the discussions of possible amalgamation? Thank you.
Is there any thought from the general manager about our neighboring hospitals that are outside of our area?
Through you, Mr. Chair, we did not discuss or were provided any information on Grey County, so I don't have any detailed information about that. I don't believe it was part of the review, so we certainly could look at the details and come back, but we didn't receive any information on that situation.
Thank you very much. In support of what Councillor, I'm going to get you in a minute here, Councillor Hamlin, but in support of what Councillor Hamlin's saying, I can assure you that the local share for our capital project to build our new Collingwood Regional Hospital includes the town of Blue Mountains and Grey Highlands, which are in Grey County, and they're in fact going to be supporting that. So that's something I think our team should be aware of. Councillor Hamlin, go ahead.
Yeah, I mean, I like all the recommendations in this report, and I think it was time that we updated how we looked at this. And these are thoughtful conclusions, and I'm glad we've already had impact on the IT front, potentially. But perhaps when this goes forward, if even a mention could be had to the ministry to consider a little broader circle around, if they are going to consider encouraging the hospitals to amalgamate, they consider beyond the county if they think it's appropriate. Thank you.
Good advice. Thank you very much. I have Councillor Fryer as my last person on my list. Go ahead.
Thank you, Chair, and thank you very much for the presentation and the review. I generally, in my experience over the 4 years of working through things, I find that our hospital alliance works very well together and do a collaborative approach in trying to be as efficient as possible. I have no problem with the recommendation. It says consider the merits of amalgamation. And I think it's always good and prudent to periodically review your situation and decide if if it's the best way to do it or not. And so I'm supportive of it as is written. I think it's a well put together report, and I fully expect that our alliance will work very closely with the county on evaluating the merits of amalgamation and determine what's the best course of action. So very supportive of it. Thank you.
All right, thank you. Sorry, I slipped over Councillor Walker, and I'm not trying to. This is getting to be quite a list here. Councillor Walker, then Councillor Snell.
Thank you, Mr. Chair, for your indulgence. I'm uncomfortable with the wording of the with respect to amalgamation as well. My question is further to comments from a question on the alliance participation in discussions. So I understand with respect to the first set of recommendations that they were in concert with that. Were they in concert with the recommendations under heading B? Were they supportive of those recommendations?
General Manager?
Just to clarify, you're looking for the feedback from the hospital partners regarding the second set, the advocacy
yes.
components?
Yes.
And I'll look to comment.
Thank you. Through the chair. As I mentioned, we presented both sets of the recommendations to the hospitals. And this one, I didn't hear any kind of a pushback on it. Because the way we've worded it is not that we're recommending the hospitals to amalgamate. These points are connected. If you look at number 1 and number 5, our recommendation for the ministry is basically to consider how the collaboration level is going to work and consider it through advanced analytical ways and decision making. So all of that is to recommend to them to get together and share more. And the hospitals were actually supportive of that.
Yeah, I understand. I just don't, with what you're saying, why is the word amalgamating in there then? Why isn't it consider the merits of efficiencies? Because we have a large geographical area. Number of hospitals might be high, but so is the geographical area when you compare it to other regions. So, and I think I have enough faith in the CEOs of our hospitals that they are looking at things like that. But certainly amalgamation would be, I can't see it would work very well. Thank you.
Through you, Mr. Chair, I may make a suggestion around the word amalgamation. Perhaps the wording can be revised to suggest formalized partnerships or something of that nature that doesn't actually include the word amalgamation, if that pleases council.
I think the word consolidation works well. I'd like to go to Councillor Snell, then Norcross, then Cox, and at some point, somebody should call the motion. Snell's up first.
Thank you, Chair. I appreciate the advancement in the discussion of eliminating the word amalgamation. We've got 4 great functioning hospitals, a little over 1,000 beds, spread over 1.86 acres of land, serving 533,000 people, give or take. And just earlier today, we saw how impactful the Heart Hub is working, and how working together, working collaboratively, being as efficient as possible with every dollar, it's working. So I would support that for sure, because we're seeing our new builds as it's coming to Collingwood for South Georgian Bay. You know, the community is being asked to raise $100 million to go towards 10% of construction and fixture furnishings and medical equipment. And there is donor fatigue across the region in every community and highly competitive projects. In our region alone, we've got the hospital, the women's shelter, and a massive humane society all asking for dollars at the same time. So anywhere we can find efficiency and collaborative work, I agree. The word amalgamation makes everybody anxious. I think I support the formalized arrangements that you had mentioned. Thank you, GM.
Thank you for those comments. And you're absolutely right about the new hospital coming to South Georgian Bay. It's going to be great. I will ask for Councillor Norcross.
Thank you very much, Mr. Chair. Respectfully, can I give my spot back to you in regards for Councillor Cox to make one sentence, but it's your call, Mr. Chair.
Thank you, Councillor Norcross. Councillor Cox.
I just want to say, I think everybody's getting the fear of closing and amalgamating. What I see from my background with healthcare and different things is we're talking about services. We're talking about consolidating services, ensuring that every hospital does the best they can so that when I go or you go, you get the best care for your new hip, you get the best care for cancer treatments. And I think we're getting worried that we're going to close hospitals. And I don't think you can because of the size, as Councillor Snell said. Thank you. That was more than one. I'm sorry.
Thank you. I'd just like to comment on that and advise that, of course, every person in this room who pays provincial taxes and every citizen in Ontario pays provincial taxes to help us run our hospitals. So I appreciate all of those that work in healthcare and those that are administrators that have to fund it. Councillor Norcross.
Thank you very much, Mr. Chair. May I please respectfully request that we call the vote?
I respectfully accept. Thank you. Thank you, everyone in the House, by the way. This has been a very good discussion. I want to thank our presenter from Ernst Young. Thank you. And GM Sinclair, as always. A very good report, and it's created an awful lot of discussion, but that's very valuable information. Council, I have read it once. Would you like me to read it again? Thank you. We have a mover and seconder of Rawson and Deputy Warden. I will call the motion. Those in favor? Are there opposed? That'll carry. Thank you very much, everyone.
For Simcoe Community Media, I'm Deepak Bidwai. This story was supported by the Local Journalism Initiative.